Thank you, Dr. Wyckoff, and thanks for inviting me here. Thank you very much. I'm honored to be here at this very prestigious lecture. So I'm going to start off by telling you a little story. This is a story about John and Mary. And John and Mary are out to dinner. It's their 25th wedding anniversary, and John turns to Mary and says, "Oh, Mary, this is such a special occasion, our silver anniversary. I want to do something really special to celebrate. So would you like a Jaguar or a mink coat or maybe a vacation in Tahiti?" And she looks him lovingly in the eye and says, "John, I need to tell you now, I want a divorce." And John doesn't know what to say for a second. And then he immediately says, "I really didn't want to spend that much." So this is not a lecture about marriage, but it is a lecture about worth and how much we want to spend. How much is it worth it to us? And the question is, how much is innovation worth, and what are we willing to spend, and how far are we willing to go to pursue it? So if you read reports from really important organizations like the National Academies of Science, when they're talking about the modern research university or talking about science, very frequently they'll start out with some kind of a statement like, innovation is the engine of science. Or we frequently think that innovation is the vehicle that has brought us so much health and prosperity in our generation, maybe in our century. And so you would think that it would be really worth a lot, and we would be willing to do whatever it took to maximize innovation within our research universities, right? But it actually turns out that there have been a number of pundits of late who have suggested that, in fact, if anything, innovation is being lost in this country, and that we're really falling behind globally in terms of our competitive edge. And so this is a classic example. There were two reports commissioned by the presidents of the National Academies of Science, two blue ribbon reports, Rising Above the Gathering Storm and then Rising Above the Gathering Storm Revisited, Rapidly Approaching Category 5. I think you get the idea, something's wrong. And it said, without a renewed effort to bolster the foundations of our competitiveness, we can expect to lose our privileged position. And it went on to say that America is losing, and I quote, its creative ecosystem. Similarly, David Brooks and a number of others writing in publications like the New York Times, David Brooks said, a time traveler arriving in 2011 after having blasted off in 1970 would be disappointed at the pace of progress if she expected to see advances on par with those of the first half of the 20th century, when horse-drawn buggies transmuted into moon rockets. All right? Now, not everybody ascribes to that same philosophy that we're not innovating fast enough. There are people who are exactly on the opposite end who say, like Ray Kurzweil, if any of you have read his books, he says, we won't experience 100 years of progress in the 21st century. It will be more like 20,000 years of progress. The merger of biological and non-biological intelligence and ultra-high levels of intelligence that expand outward into the universe at the speed of light. Whoa, right? So, who's right? And my answer is, they both are. They're both right, even though they're extreme opposites. And I'm going to try to explain to you why I think that that's true. And I'm going to put this in the context of two major frames. The first one is that the system of science balances creativity with practicality. Now, it turns out that that actually is the definition of innovation, which is to say that innovation is not just creativity. Innovation is creativity with a use. So it's practical creativity. So it's not surprising that our universities would be balancing creativity with practicality. But what I'm going to suggest to you tonight is that that balance has become tipped very much towards the practicality side, and that the creativity side is suffering as a result. So let's just define terms for a second. When I asked my faculty, what is creativity? I mean, I literally did this survey of our faculty. Here are some of their responses. They said, creativity is what if. It's anything is possible. It's no holds barred. So it's this completely unencumbered, actually non-linear, who knows what will happen, which means that some of the things that will happen will in fact not be terribly useful, kind of activity. What's practicality? Practicality is the avoidance of activities that retard progress, that disappoint, that erode core business, that threaten reputations or are dangerous. So it's, all the things that we are very familiar with at university. It's rules and regulations, trying to make sure that we don't take this unencumbered creativity and actually hurt somebody with it. And by the way, part of the reason why the picture behind here is actually a picture of, it's actually a picture of an atom, in fact, is because the atomic bomb was really probably the moment in history where society appreciated the potential threat that science had to bring to the world, both the potential power but also the potential threat, and that's the balance. So the second frame is not all innovation is alike. So I'm going to posit for you that there are really two kinds of innovation. Now, it may turn out that this really is more of a continuum than it is a dichotomy, but nonetheless, for purposes of description and argument, let's put them into two categories. So the first category I term little I innovation. It's also been called evolutionary or stepwise innovation. And the second category is big I innovation, which has sometimes been called revolutionary or paradigm shifting innovation. If any of you have ever read Thomas Kuhn's book, you'll understand what paradigm shifting is. But basically, little I innovation is it occurs through a series of fairly clear linear steps. It's quite logical. And I don't want to take anything away from it because it's brought us wonderful things, particularly in the areas of technology and engineering. So things like cell phones, like GPS, like the safety of anesthesia, which is, checklists. All of those things come from little I innovation. Big I innovation completely breaks everything that came before it. It has to be an entirely disruptive new way of thinking about things. You simply cannot think about things the way that it's not stepwise at all. It's heuristic. It's a leap. So for instance, the transistor was a complete departure from what had come before it, which were vacuum tubes. The theory of special relativity, of course, Einstein's special theory of relativity, was not only disruptive and a leap, but it was so bizarre. I mean, if you think about it, it's, kind of the notion that space and time are not linear, it's just a very, very bizarre set of ideas. Germ theory, which I'll come back to in a second, was a complete departure from the notion of miasmas that came before it. So not all creativity is alike, and that's going to turn out to have profound implications. So when we think about creativity, let's think about it from two perspectives, at least two perspectives. So we're going to think about it from the perspective of society, and we're going to think about it from the perspective of institutions. And I would say there's obviously an individual perspective as well, but I don't have time to go into that tonight. And I'm only going to take kind of one slice of this, or one orientation to this, and it's really kind of an economic orientation. So from society's perspective, obviously what we want is as much creativity as possible, as much innovation as possible, right? Because we believe that it is a driver for health and prosperity and economic development. And so this was a quote from, again, a National Academy study on the research universities in the future of America. America is driven by innovation, advances in products and processes that create new industries and jobs, contribute to our nation's health and security, and support a high standard of living. Well, we want as much of that as possible, right? So that's all for the good. And I would say, by the way, and I'll come back to this probably more than once, that big I innovation, that frame-shifting innovation, those leaps of discovery, give us massively more of what society is looking for, this societal creativity that engines jobs and health and security, than actually does little I innovation. And moreover, the other thing that I would say about big I innovation is that if we look at the major threats in our generation to what I call health and humanity, health and welfare, things like, certainly in the U.S., kind of our healthcare system, which of course is in great disarray, diseases like Alzheimer's disease, I could add cancer, I could add emerging infections, lots of different diseases, obesity, you could talk about global warming, you could talk about water scarcity, lots of different things could be on this list. I could go on and on. But those major threats, science has been trying to find solutions to those threats for a long time without an enormous amount of success. And I would argue that it will not be through evolutionary, but it's really going to have to take some really revolutionary, some real change in thinking to basically resolve these problems. So sticking again still with this issue of big I innovation, and which I'm going to call the kind of creativity side of our balance. So fundamental discoveries have again, fundamental, highly creative, highly paradigm-shifting discoveries have what economists call positive externalities. Positive externalities basically mean that they have lots and lots of downstream effects. So it's not just that something is found, but it's something is found and it changes the world, literally changes the world. So germ theory is just such a fantastic example of this. The CDC says that in the last century, Americans have gained 30 years of life expectancy, and 25 of those 30 years are a function of public health. Well, what exactly are those things? Well, the biggest one is sanitation. That is what gained more years of life expectancy than probably anything else ever. But some of the other ones are vaccination, antibiotics, right? Safe childbirth. What do all of those things have in common? Germ theory, all of them. If we did not have our current understanding of germ theory, none of those would have been possible. So think about 25 years of life expectancy, a generation that each of us will live longer than we would have a century ago, attributable to this one theoretical notion, this one discovery, germ theory, right? So that gives you a sense of these positive externalities from real leaps in innovation. On the other hand, big I innovations produce, and again, we're sticking with economics for the moment, they produce what are called non-excludable goods. What does that mean? What that means is that you don't have to purchase them to enjoy them. All right? So if I'm company A and I come up with some big leap innovation, some big I innovation, it's very unlikely that I'm going to be able to own that idea. And therefore, I likely will not be able to fully profit from it. And even worse, my competitor, institution B, may actually be able to leverage it and profit from it even more than I do. All All right? So big I innovations are typically non-excludable. And the other thing that's perhaps bad, as it were, about big I innovation is that it's maximally disruptive. And what I mean by that is, I mean that have any of you ever read Clay Christensen's work on disruptive innovation? Okay. So Clay Christensen talks about this notion of disruption, and the notion of disruption as applied to science means that everything that came before is no longer relevant, all right? And so what that means is that you have a whole generation of typically very established scientists that are just plowed. Like, you're irrelevant now. People love that. You know, they enjoy that a lot. And so you can just imagine that doesn't go over really, really well. And so typically it takes a long time for big I innovations to be accepted and moved into practice. Okay, so I just, again, want to kind of nail this point for one quick second. So as you see here, this slide, I've just elaborated on the big I innovations side, and I've added some additional big I innovations like the Human Genome Project, evolutionary theory, our current notions about the microbiome. So that's all the good microbes that are in our gut and other parts of our body, because we always used to think that microbes were bad, now we think they're good. But anyhow, so these are completely different disruptive ideas. And again, as you can see, they're non-excludable. I mean, you know, these ideas, you can't patent them. So now let's talk about the practicality side. And again, this I'm going to kind of equate to the small I innovation. So little I innovations, on the other hand, produce excludable goods. So they must be purchased to be enjoyed. That's a really good thing, certainly for institutions. So, you know, equipment, techniques, drugs, products, those very discrete things can be owned and marketed and commercialized and economically benefited from. All right. Little I innovations also go into building processes, building better and smarter processes through stepwise innovation. And that's what we actually call entrepreneurship, right? And so the classic definition of entrepreneurship is shifting resources from lower to higher productivity. Well, that's really little I innovation. And as you know, probably the greatest example in the history of mankind of little I innovation when it comes to this process optimization is McDonald's, right? And I'm very serious about that, because what McDonald's did is they took a product that's nothing, right? It's hamburgers and French fries. It's like what Mom always made and was really delicious. But they developed very standardized processes around these products that would allow them to expand the market to billions and billions of people. So, little I innovation is rational and incremental, it's safe, it's analyzable, right? I mean, you can look at each one of those little steps. It's fantastic. It's highly market responsive and, you know, economically wonderful. Big I innovation rips the fabric of normality. It demolishes the old. It's a leap of faith, and it's antithetical to market forces. What do you want as an institution? What do you want? Guys, I know you're awake because your eyes are open.
One that's not antithetical to my institution.
Right, thank you. All right, so creativity and practicality. Let's move from society to institutions. The first quote here is from an Institute of Medicine study on the Academic Health Science Center. And the quote is, "The creation of knowledge and the commitment to education as foundations for treating illness and improving health." This was actually the definition that they came up with for what should an academic health science center be doing. The bottom quote is the definition of business, the creation, trade, or transfer of goods and services or both to consumers. Now, the interesting thing is that these two have a lot in common, all right? So if you think about the creation of knowledge and the commitment to education as being our creation, trade, and transfer of goods and services, what that tells you is that research universities are, not surprisingly, businesses. All of us who are administrators know perfectly well that we are in a business. We're in the business of higher education. We're in the business of research universities. Not only are research universities businesses, they are big businesses. So academic R&D, research, just the research and development part of academia, is about a $60 billion business. And we know that we have a revenue stream and we have an expenditure stream in research universities, again, on the research side. Well, not just on the research side, but in research universities. So, our revenues come from things like grants and tuition and philanthropy and sports and state funds and clinical revenues. And our expenditures are personnel and fringe benefits, physical plant, depreciation, utilities, et cetera. So we are businesses and we have classic business streams, accounting streams. And the interesting thing about that is if you think about research, and again, we're talking about innovation, so we're really talking about research here. It has been said that research loses 15 cents on the dollar, that every dollar that you bring in from a grant, that the research university basically loses 15 cents. Well, how can it be that then research universities want more research if in fact research is losing money? And the answer is that that's not really true. It doesn't really lose money, because what research actually does is it creates a multiplier effect. Research contributes mightily to prestige, and prestige brings in superstar faculty and students, and those superstar faculty and students bring in grants, they bring in commercialization revenues, but very importantly, they bring in philanthropy. And so here's an example. So Stanford in the year 2006 had about $1 billion in grant, $900 million in grants. They had about $62 million in licensing and equity income. But from 2006 to 2011, they launched a 5-year campaign in which they brought in $6.2 billion, mostly from alumni. Their alumni are people like Hewlett and Packard, right? You have to understand. This is Silicon Valley. They created Silicon Valley to a great degree. But anyhow, the bottom line is research actually brings in quite a lot of money, especially for these elite universities. But the fact of the matter is that we know perfectly well that not every university is an elite university, and in fact most universities are struggling. They're not benefiting hugely from the Stanford model. They're really barely making it these days. And one of the reasons, of course, as you know, is that federal funding flattened and is now declining. So grant availability is declining. Federal grant availability is declining. Another reason is that, of course, state funds are declining, and so most states have had a decline, or most research universities that are public universities have had a decline, in many cases a substantial decline in their state funding. And moreover, tuition, which is how many research universities have historically kind of floated their boat, is under an enormous amount of pressure. I mean, it's increased so substantially over the last decades that it's not clear how much farther it can go up. So it's what people call the perfect storm, right? I mean, everything is really doing poorly on the revenue side, and so universities are under an enormous amount of stress. So these businesses, these university businesses, are under an enormous amount of stress. And they have to think to themselves, where's the next revenue stream? And so the next revenue, I'm actually going to skip this for a second. So the next revenue stream, very obviously, has been in technology transfer. So universities are racing after this notion now that if we can generate excludable goods, we can patent them and we can generate revenue from them. We can commercialize them. And in fact, it's true that universities are certainly generating more patents than they did in the past. So over the past 4 decades, the number of universities' patents has risen from 200 to 3,000, very large increase. And in 2006, 189 top universities generated $1.5 billion in patent revenue. That's no small change, obviously. So there is a reality to this. But on the other hand, again, kind of looking at this balance between creation and caution, patents, I think, actually threaten big I innovation. And the reason why I say that is because if you look at a place where there's, I think, greater maturity in the patent business, which is actually in Silicon Valley, in the tech industry, Google and Apple now spend more on patent litigation and purchases than they do on research and development. And moreover, there's actually been some data generated from a particularly interesting example of this, which was the Human Genome Project, where, as you may know, the story was that the NIH, and which was obviously all open source and public, and Craig Venter, on the other hand, who was the CEO of Celera, which was a private group, battled for the coding of the human genome and basically came in a dead heat. And Venter actually patented some of the human genome sequences. And it was subsequently shown that those sequences that he patented were slower to be elaborated upon and disseminated. So there is some data to suggest that, if anything, patenting actually slows the progress of science. But moreover, patenting, again, is all about little I innovation. And institutions, if they're running after basically, commercialization, they're running after little I innovation, and I would say at the expense of big I innovation. And there have been many pundits, and I skipped a couple of these big long quotes, that have been writing in Science and Nature and many of the other major medical and science journals of late that have really decried this notion that we're moving away from basic science, we're moving away from big I innovation, at our own risk. So another kind of facet of this, which relates to this patent issue, and I wanted to make sure that I noted, is the winner-takes-all system of science. So this notion that ideas are owned, which again is the basis of patenting, also has a lot of other implications. So idea ownership is really the basis of our system, and the winner-takes-all notion is the basis of our system of promotion and tenure. At many academic institutions, you kind of count up the first and last authorships, you count up the number of NIH grants or other major federal grants, particularly R01s, which was kind of the coin of the realm, and that's the basis on which people get promoted and get tenure. But the fact of the matter is that has real consequences in terms of lack of ability to participate in highly collaborative science, lack of ability sometimes to share all of our findings immediately and in a very open kind of way, lack of ability to really leverage the power of the internet in what's been called crowdsourcing, which is, highly multi-person, multidisciplinary science. The other consequence of the kind of winner-takes-all system has been increasingly funding and the ability to do science is getting more and more concentrated at the top in fewer and fewer hands. So 50% of NIH funding goes to the top 15% of investigators. And I think this is a really shocking statistic that in 1980, 18% of PIs were less than 36 years of age. Today, that's 3%. I'm going to say that one more time. In 1980, 18% of principal investigators on NIH grants were less than age 36, and now it's 3%. The other thing is it leads to this very interesting problem of fraud, frankly, that the game is such a high-stakes game and that it's so important to be winner-take-all and so important to have ownership that actually the amount of fraud in science has multiplied sixfold just in a 5-year period when this has been measured. So we have to ask ourselves, I'm a very outcomes-based person. I tend to spend a lot of time what I call thinking backward. So I don't think stepwise, we go here and we go here. What I think about is where do we want to get to and what were the steps that we used in getting there backwards. And so what I want to ask is the really important question, which is, what does all this mean? I mean, what does that balance between creation and caution really look like? Are we creating in America's research universities today? I mean, is practicality so heavily weighted that it's adversely influencing our ability to create? Well, on the face of it, the answer to that would be no, it's not. We're doing just fine. We're doing great, as a matter of fact. As I said, they're both right. So if you look at the top 5 research universities in the country, and I won't name them, but you probably know who they are, they are the top-rated universities in the U.S. News and World Report rankings. They have the largest university endowments. They have the most patents, and they have the greatest number of total and high-impact publications. So they're producing lots and lots of little I innovation. I mean, they really, something's going right. But now I'm going to tell you the other side of this, which is, what if you ask yourself how much big I innovation, how much of this, purer creativity, as it were, are they producing? Well, the answer to that question is nobody knows. And do you know why nobody knows? Because nobody's asked. No, I'm very serious. No one's ever studied it, right? So I did a little back of the envelope study. Now, this is very non-scientific, but I'll tell you how I did it. Science Magazine put out an issue called Insights of the Decade in 2010, where they looked back over the first decade of 2010 and they said, what were the biggest breakthroughs in that decade, all right? And they credited a number of individuals and a number of others. And amongst the 30 individuals that they credited for these greatest breakthroughs, these biggest hits, only 2 of them were at those top 5 U.S. News and World Report universities. 4 individuals from 2 of the 5 universities. 3 of the universities weren't represented at all. The second observation about this is that the affiliations of the people who came up with these greatest hits were very surprising. So a number of them were at places that you have never heard of, or certainly rarely heard of. A third observation is that many of them came from very large groups, huge groups. In the case of almost all of the ones in physics, they came from groups that numbered as many as 1,000 investigators, right? So really huge group science, crowdsourcing science. And the final observation is that fully 25% of these greatest hits came from outside of the United States. So basically, it's not these top U.S. research universities that are so highly ranked that are necessarily supplying us with the big I innovation. They're coming from a bunch of very surprising places and done in surprising ways. So at this point, you all been shaking your heads a bunch, and it's probably because I haven't told you anything that you didn't already know, right? You kind of already knew all of this. Now let's talk about some things that you may not have thought as much about. How am I doing on time? What time did we start? We're doing it. Okay. So Let's talk about what would disruptive solutions look like for those three things that I listed previously: healthcare reform, Alzheimer's disease, obesity. First, let's talk about the problems. I want to now weight creativity higher than practicality. I literally want to weight creativity higher than practicality. So, the first thing to say is, if all you got is a hammer, everything is a nail, right? One of my favorite quotes was from a guy named Mark Halpern, who's the chancellor at NYU Medical University. He actually went to, I did a keynote and he did a keynote behind me at a huge annual meeting called ASTRO, which is radiation, is the national meeting of radiation oncologists. And he literally had the audacity to say to them, if radiation oncologists had put in charge of the war on polio in 1945, by 2012 they would have perfected the iron lung. So if all you have is a hammer, everything is a nail, right? That's not how we solved polio. It was with a vaccine. All right. So we need to think about these things really differently. And here's the situation with respect to healthcare in the world. Here, the whole rest of the world is shown with these little dots in this red line, which basically shows you the relationship between healthy life expectancy and healthcare expenditures. And you see where the United States is, right? It's completely off the line. So we spend massively more for kind of every year, as it were, of additional life expectancy. In JAMA 2012, they pointed out that approximately $750 billion, 30% of healthcare spending in 2009 was spent on pure waste. Nothing good, pure waste. And here's a shocking statistic, I thought, from the Iowa Institute of Medicine. Although average income has increased by 30% over the past decade, these gains have effectively been eliminated by a 76% increase in healthcare costs. That, I think, is shocking. So basically, what that means is that the opportunity cost from this ever-increasing set of healthcare expenditures has basically eaten up everything that we could be spending on lots and lots of other things like education that we'd really prefer to be spending that money on. Okay, so that's the problem with healthcare. Alzheimer's disease affects 5.3 million Americans, costs $172 billion, no cure in sight. And obesity, how many of you have seen this? Probably everybody, these maps. So, as you see from these CDC maps, you look at 1991, 1995, 2000, it's been updated to 2010. I just don't have a more recent slide. But America's all red now. That says nothing about politics, by the way. That's just what they color it, obesity, on this slide. But the bottom line is a third of Americans today are obese. 2/3 of Americans are overweight or obese. This is what we say, Houston, we have a problem. We have a big problem. And the fact of the matter is, it's not getting better. So this is a complete failure, I'm a public health person. This is a failure of public health, right? I mean, it's not going in the wrong direction. It's probably stabilized at this point, but it's not going in the right direction. Okay, so let's go back to healthcare expenditures. This is my more and better slide. More is not better when it comes to healthcare. So let me just be very straight about this. My view of the Affordable Care Act, what in Texas is called Obamacare, is that it does not and will not fix the problem of healthcare bankrupting the United States. And the reason why it does not and will not is because cost containment was not a major component of Obamacare. It was, the major kind of emphasis was on increasing access. Well, increasing access will cause more money. It's not completely surprising to me that states like yours, as of yesterday, are turning down the Medicaid expansion. Texas is kind of in the same state. Now, as a public health person, you might say, oh my gosh, how can you stand up and say that? Well, I can say it because, when you add more people into a mix of a healthcare system that is spending 2.5 times more per capita than any other healthcare system in the world, and by the way, getting worse outcomes, there is something so wrong in that picture that just increasing access is not going to keep us out of bankruptcy as a country. And as I just showed you, there's a huge price to pay for all of that money that we're spending on healthcare, right? So sometimes you have to speak the unspeakable. And one of the unspeakables, which was published in the Chronicle of Higher Education, was this notion that a competitive marketplace will determine a market price, but not the social value of a product, all right? So our healthcare marketplace will, in fact, determine a price, but it won't tell us what's valuable, and it won't tell us where that 30% of waste is. And the real unspeakable is this word, rationing. It's completely unspeakable. But yet, finally, this year, there's some organizations that have come out in campaigns like the Choosing Wisely campaign that have said, there are things we shouldn't be doing. There are medical procedures we shouldn't be doing. There are diagnostic procedures we shouldn't be doing. We shouldn't be doing these things. We need to control cost. More is not better, right? All right. When it comes to Alzheimer's disease, the thing that's fascinating about it is that we're all on the treatment side. We're terribly concerned about Alzheimer's disease. We're really conflating Alzheimer's disease with the process of aging. But the fact of the matter is what we really need to be thinking about, it's not to say we shouldn't be thinking about the treatment of Alzheimer's disease, we actually should be, but what we really need to be thinking about is prevention. We need to be thinking about prevention of unhealthy aging, right? There are people who age healthily, and that's a wonderful thing. Aging is not a disease, right? Aging is good, kind of. Maybe on some days. But the fact of the matter is, it's really about healthy aging. It's about active life expectancy, and it's really about studying prevention, which we do very little of. We understand unbelievably little because there's unbelievably little research about what are the proactive measures we can take to age in a healthy way. I'm going to give you one more kind of out-of-the-box on this aging story. This actually comes from my students. My students in a class that I teach on innovative thinking have a semester-long project in which they have to take a problem and find an innovative solution. And they took the problem of advance directives. And as many of you may know, most people in this country, even people who are dying, actually don't have advance directives, or their doctors don't know what their advance directives are. And as a result, we spend a huge amount of money in the last 6 months of life, and I think it's a quarter of all Medicare expenditures are spent in the last 6 months of life, and we don't have enough organ transplantations. All sorts of problems come from that. So anyhow, if everyone had an advance directive, it would be a very good idea. Well, what's the problem? The problem is we can't talk about, again, this is what the things we can't talk about. We can't even talk about these things, right? We can't talk about death and dying because it's like way too scary. And by the way, if we talk with grandma about the fact that she really is going to die, we're wishing it on her. We don't want to have that conversation. So they said, well, how could we think about this in a different way? This actually gets to this book that I wrote called Innovation Generation, where I talk about frames and alternative frames, and the frame here is death is scary, serious, sober, and mysterious. What would be an alternative frame? Well, it's really hard to think about death in any other way. That is what death is. It's pretty scary, right? But Benjamin Franklin had a different way of thinking about it. He actually said, nothing in life is sure except death and taxes. And so this is what my students came up with. This is called the U.S. Individual Advance Directive Claim Form. And it looks exactly like a tax form. And it basically takes death from something that's scary, sober, mysterious to something that's just bureaucratic, right? I mean, you don't want to do it, but you got to do it. So the idea would be every year you'd submit your U.S. Individual Advance Directive Claim form with your tax form. You'd get a little rebate for doing it. You could update it whenever you wanted. It would be linked to your electronic medical record, through the web, and your doctor would always know what your advance directive decisions were. And all you have to do is check off little boxes every year, right? Is this a brilliant idea? This is brilliant. My students came up with this. Think about things really differently. Okay, final one, obesity. Think about it really differently. For a generation, we've only thought about obesity one way. Only one way. Blame the victim. Right? All of our clinical trials have been about how can we change diet and exercise in just a little bit of a different way to make sure that people lose weight and retain that weight loss. Well, let me tell you something today. Guess what? We can get people to lose weight. We really can. I mean, there have been hundreds of clinical trials that have gotten people to lose weight. We are really, really good at it. What's the problem? We can't get them to retain the weight loss, right? They just go right back up again. People, particularly people who are obese, the only thing that works is bariatric surgery, and it's not a population intervention, right? Until something, and by the way, I think that's also an area of innovation, is making that into a population-based intervention, but that's a whole other story. But in any case, so what I'm going to say is, this was an article that I wrote in Psychology Today. It was entitled, Why Do We Hate Big Tobacco and Love Big Food? So what I'm going to tell you is, and I won't go into the whole argument, you can read the article, but what I'm going to tell you is that the food industry, and other people have now started to say this very, very recently, and I'm just thrilled, in very public ways. The food industry, what I call the big food industry, the processed food industry, there are about 10 companies in the United States that make about 50% of all the bad food in this country, of all the processed food that's very high fat, high sugar, high salt in this country, and actually globally, in fact. Why do we treat them so differently than big tobacco, right? And the answer that has commonly been given is, well, I mean, you don't have to smoke, but you have to eat. But guess what? You don't have to eat processed, really horrible food. And if you look at the increased caloric consumption over the last generation, it does not come from, I'm going to shock you here for a second, but it doesn't come from fruits and vegetables. That's right. It comes from processed food. It comes from those 10 big food manufacturers. So now I'm going to say something again that's so not PC, because any big I innovation is so not PC. It's disruptive. And what I'm going to say is, why are we not attacking the big food industry in the same way that we attack the big tobacco industry? Because that worked, by the way. That worked. How did we go from 60% of males smoking in the 1950s to 19% today? Because it worked. So taxation, lots of things that we don't want to talk about. We need to think about completely changing the food environment in this country. You cannot be in a toxic environment. You can't be breathing in polluted air every day and feel that you're going to escape the consequences of it. So this is my pictorial about how much things have changed in terms of tobacco. Back in the 1950s, more doctors smoked Camels than any other cigarette. Today, if you saw a kid smoking a cigarette, it would be completely anathema, right? Complete culture change. Okay, so finally, I'm just going to throw out a few ideas related specifically, not so much to specific problems, but more to the system of science and this kind of notion of balancing creation and practicality. So the first one is incubate to innovate. So the first thing that I want to say about this is, as I said, not all innovation is created equal and not all people are created equal. And if you look at genius scientists, if you look at really out-of-the-box innovators, they are very frequently identifiable. Not totally, but to some degree. They're people with really wacko ideas. many of which will fail, but some of which will succeed. And I'm a believer in the notion of innovation incubators. You take those people and you make bets on them, just like we make bets on lots of other things. And you put resources into them and you put them together and basically hope for magic to happen. But interestingly enough, that has happened in the past on a number of occasions in our great universities. At Oxford and Cambridge and Stanford and a number of other places, that's exactly what happened. That's exactly what created some of the greatest genius scientists of over generations. The thing that most of these great, national academies, et cetera, panels have always said about increasing innovation is support to incubate. So this is a quote from, again, this National Academies Research Universities in the Future of America study. The federal government should adopt stable funding for university-performed research and development and graduate education. I completely agree with the stable component. I don't agree with the notion of simply throwing more money at innovation. The problem is not necessarily that we need to throw more money at it. The problem is that we need to be smarter about it, and we need to be portfolio driven. So what I mean by that is this. I mean, society needs to decide in the exact same way that all of us just decide how we're going to manage our retirement portfolio. We have some things in that portfolio that are very low risk and some things that are very high risk. And those very low risk things we know are going to lead to less yield, and the very high risk things potentially lead to more yield, but obviously are riskier. Society needs to do the exact same thing. It needs to develop an absolutely transparent portfolio around research. And it needs to say, we're willing to spend X proportion of our taxpayer dollars on things that are really risky, that are really disruptive, and are potentially will lead to big I solutions. Diversify to innovate. So two components of this. I'm going to just tell you a story about Howard Hughes Medical Institute here for a second. Howard Hughes Medical Institute developed a facility called Genelia Park about 6 years ago. It was the first time that Howard Hughes had actually had a physical location. Prior to that, they had just funded investigators at various universities. And I don't know if any of you know how successful the Howard Hughes model has been, but they fund about 300 investigators. Their classic program funds about 300 investigators at various institutions around the country. And of those 300 investigators, 14 of them have gone on after becoming HHMI investigators to win the Nobel Prize. That's how successful they are. And so this is a very interesting model. And there are two components of Genelia Park that I want to point out. One of them is that Genelia Park is not about, let's go out and do a lot of really good science. Genelia Park is, let's go out and solve a major challenge. So it's all around neuroscience. It's all around trying to understand how brains work. And they brought together every conceivable discipline. And when I say every conceivable discipline, I'm not just talking about, molecular biologists and genetic biologists, and I'm talking about anthropologists and engineers and librarians, and it's crazy, right? So really multidisciplinary. And then they do a whole lot of things to get people to bump into each other. So I'll just give you one example. They have lunch for an hour and a half every day. There's a beautiful sit-down dining room. And the food is phenomenal. I went there as a visiting professor and got to spend 2 days with them, and it was just one of the greatest experiences of all time. But Genelia Park is in the middle of nowhere, right? There's not even a grocery store. If you want to eat, you eat during that hour and a half. And so what that means is that everybody gets forced, basically, to sit together at lunch. Well, that's kind of neat, it's kind of forced crowdsourcing. Another thing about the HHMI model, which is true at Genelia Park and it's also true for their Howard Hughes investigators, is they support, and I quote, people, not ideas. People, not ideas. What does that mean? What it means is that their investigators don't write grants. Their investigators are supported by Howard Hughes for years and years and years through multiple failures, through changes in orientation. They invest in a person. They pick a person and they say, we're going to stick with you through thick and thin. Now, not forever and not completely if they're just, complete bozos, obviously, but to a very great degree. And again, it's been this very, very successful model. We don't do that, obviously, in our extramural system at all. We make people, go after each separate idea, and it takes forever, and they spend all their time churning and doing this. And I think that a part of, again, this portfolio management idea really should be support people, not ideas. Prototype to innovate. We were talking about this earlier. There's a fellow named Drucker who's a management guru who talks about the fact that if you have lots and lots of little things going on and you don't put all your resources in one basket, but you do lots and lots of littler things and pursue, all of them as far as they'll possibly go, which is called prototyping, you get a lot more innovative bang for your buck. So at the NIH, NSF, our federal funders, what I like to say is the perfect is the enemy of the good. Every proposal has to be perfect. That's a terrible idea. Proposals shouldn't be perfect. They should be good enough. Feasibility trumps creativity. Practicality trumps creativity. All you have to say on an NIH review panel, believe me, I've been there, is this study is infeasible. That's it. It's gone. It's done. Doesn't make any difference how creative it was. Pluralism for innovation. So I am a huge believer that the most extraordinary thing that's happened in the world of innovation in our lifetimes has been the internet, the creation of the World Wide Web. It's a disaster how little science is able to harness the power of the World Wide Web. Why? Because of this problem of idea ownership. I mean, if you're part of a crowdsource, you don't get any benefit from being part of that team, right? I mean, you're never going to get promoted in tenure if you can say, well, I was one of 1,000 people that came up with this really great idea, right? All right. So again, I don't know if you saw this cover of Time magazine. It was absolutely great. But, Person of the Year, you. Pluralism, democracy for innovation. Change promotion and tenure guidelines to allow engagement in open science. That would be really disruptive. Simplify to innovate. Get rid of some of this practicality. My secretary says something that I just absolutely love. It's such a Texanism. She says, you got to know what's necessary and what's nice, right? Things that are necessary regulation is necessary. I mean, there is a reason why we have IRBs, a really good reason. But once you go past that point of necessary to just nice, thank you very much, you really have squandered a lot of talent and a lot of time and a lot of creativity. So reduce federal regulations and restrictions and increase autonomy from state controls. And then the very last thing that I'll say is, and perhaps the very most important thing, is that in order to innovate, we must recapture the joy of science. We have taken the joy out of science at all levels, K through 12 education in science, higher education in science, and in doing science. When I talk to young faculty, and this was beautifully demonstrated when Science magazine at the turn of the 21st century put out a call to young investigators, and they said, what are your challenges and what are your opportunities in science? And they got back all of this unbelievably cynical stuff, like we are completely hampered by the last generation, we're completely handcuffed by problems with funding, on and on and on and on. We must recapture the joy of science to capture innovation. And that's it. This is my regulatory financial disclosure statement required for this talk. But I'm happy to take your questions.
I'll start with a question. the idea of investing in people is in some ways what we do in higher education. We hire people and we don't put 8 hours a day requirements on them. I apologize. But we don't always see that type of innovative creativity. How can you encourage that even within the framework of what exists?
Well, I mean, so here's the thing. Let me just actually tell you how I came to give this talk, because there's kind of a story behind it. So as I said, I wrote this book, Innovation Generation, and that book is basically about a method. It's a method of how to innovate. And it captured a lot of interest and attention, and I got asked to do maybe 36 talks at various universities around the country, including some of the very elite private universities. And each time I would give one of those talks, a young person, and I swear this happened almost every single time, a young person would stand up in the back of the room and they would say, "Oh my gosh, Dr. Ness, that was so inspiring, that was so cool. Oh my gosh, I'd love to do that. But wow, I can't for the following reasons. I could never get funded. I could never get promoted in tenure. I am so incredibly constrained by the system, blah, 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 blah." And after I had heard that about 36 times, I decided I need to write another book. So actually, this talk is a small component of the book that I'm currently writing, which is about, innovation in the system of science. You're right, we invest in people and then we handcuff them. And that, I think, is a real problem. Yes?
I guess my voice is pretty loud. I just wanted maybe you to comment a little bit on sustainability and how that works with innovation. Because I don't know if that comes into your thoughts, but just how a lot of the innovation in the past has never thought about the impact it will have on the future, like global warming and those
sustainability
kind of things.
From that perspective, yeah. That is a really good question, by the way, which I have thought about. We have a love affair with innovation. We have a love affair with progress. The degree to which progress is all good is highly questionable, frankly. And it gets very much to the sustainability questions. Let me just tell you a little story about this. Every country in the world uses the same indicator to judge its success. And that indicator is gross domestic product, right? We track this. I mean, it's like our weight. We want to know it every day, right? And we compare it between countries and, all this kind of thing. Have you ever heard of the genuine progress indicator? Anyone? No one. That's typical. The genuine progress indicator, GPI, was an alternative metric that was invented by a group of economists at the United Nations in the 60s, may have been 70s. And it discounts economic progress for things like sustainability and what they call non-economic outcomes, which may be things like displacing populations, but they also add in things that are non-economic, like household labor, which actually doesn't get counted in the GDP. So basically what they're trying to do is they're trying to add both economic and non-economic indicators into this GPI. Nobody in the United States knows about this or uses it. It is used in some other countries in the world, Australia being probably the most prominent example. But if you look at the trend of GDP, almost every country in the world has had huge increases in GDP over the last generation. If you look at the trend in GPI, I bet you know the answer to this. It's flat. It's flat. It's not inverse. but it's just flat. So basically, it's just like what I told you about, we're eroding basically all of the economic increases because of healthcare costs. We're eroding our productivity indicators because of these non-economic consequences. So your point is extraordinarily well taken. And I think that's another very, very important discussion that we should be having that is disruptive, which is progress really, what kind of progress is really good for you? I mean, that's a question nobody's asking, right? Good question.
Seems like your little eye is, that's progress,
Yeah, well, little I is GDP. Yeah, absolutely.
Good evening, Dr. Ness. My question is, as you know, the NIH recently revised their criteria for evaluating grant proposals to where they give less weight to methods and more weight to impact.
Right. Supposedly.
Okay. So I guess you've already answered the question. So my question is, do you think this is a move in the right direction, or is the implementation not really reflecting the aim of the change?
It's a move in the right direction. There's some really interesting studies that have come out very, very recently that suggest a lot of different things about that, but that it's probably actually more lip service than it is real. The data actually indicate that the more innovative a proposal is, the less likely it will to be funded. Actually, a very, very good study recently, I think, quite convincingly showed that. Even now. The fact of the matter is, all you have to do is get up in study section, really, been there, and say, this is just not I really don't know if this is feasible, and that's it. It's dead meat. Feasibility trumps creativity, independent of the innovative indicator.
Perhaps you can help me restore my admiration for the Institute of Medicine. Always admired what they've done, but last year I felt that they had made a move from creativity to practicality or feasibility when they were tasked with looking at essential benefits for insurance health care. How does something like that happen if you agree that perhaps there was a shift toward practicality and feasibility when they had always been much more creative in the past?
What do you think was creative in the past that was lost in that? I'm sorry? What do you think was creative in the past that was lost in that process?
I had never seen practicality and feasibility. It was always, what is the goal? It's just, as you said, work backward from what is ideal. What do we really need to include? And in this case, it was, well, let's not be so big-minded. Let's just think about what's feasible and practical.
Okay, so I think it's actually important to say this. I can't answer this question without telling you this. This is a conflict of interest. I was on that panel. I'm serious. I was actually a member of that IOM panel that made that decision. But what I will tell you is that I'm a member of the National Academies, so I get put on these panels all the time. What I will tell you is that was not, the IOM didn't decide to do that. The IOM was brought the question. In other words, the Affordable Care Act actually has language in it that says that the Institute of Medicine must tell us what these specific services are. So the question that was brought to the IOM was not should there be these specific services, should there be first dollar coverage of women's health care services, but what should they be? Now, I'm happy to talk with you offline about how that process unfolded. It was messy. It wasn't actually an IOM decision to do that. It was just implementation that we were asked to be engaged in.
Of all the fields that are out there that could possibly provide the next big I innovation, healthcare, information technology, sociology, and so on, if I can ask you to look into your crystal ball, where do you think the next big I innovation could come from most likely?
Wow. I could be a multi-billionaire if I could tell you the answer to that. Well, let me just say that one thing. If I, within my own field, all right, I can't really talk about fields that I know nothing about, but within my own field, if I was going to start my career again today, I would be a microbiome biologist. I would study the microbiome. I think the microbiome is going to turn out to be the center of the universe. I mean, I really think that there are going to be phenomenally disruptive, revolutionary insights that are going to come from understanding the symbiosis between what lives within us and our own bodies. But that's just a guess.
You mentioned that you thought tenure and promotion policies in departments and colleges could have a lot of impact on creativity, one, for the good or ill. Could you talk a little bit about the characters of or aspects or properties of tenure and promotion policies that could be really positive versus those that aren't?
Yeah, for sure. I definitely can. So what if, it's all about what if, right? What if promotion and tenure were not a quantitative measurement of the chits, right? Again, those little linear things that we do, number of publications, number of grants, whatever. What if people ask the question, what has this person contributed to science, period? That's it. That's the question. And there was no measuring of numbers of things at all. But it was, the problem with that is people get really, really flipped out about, well, okay, so how do you metricize that? What does that mean? It's hard. It's a lot harder when it becomes more subjective. But isn't that really what we're trying to do? So let's say that you're at Harvard, all right? And the question might be, okay, so, here we are, the Mecca. It might be, have you changed a paradigm? Just that simply.
Is that what you do at University of Texas?
We're not Harvard. We're not Harvard. But but we do. We are moving much more towards a subjective system of how much have you changed the world. And so I was saying earlier today, I've had the extraordinary experience in a 4-year period of recruiting 70 faculty. And when I talk to those faculty recruits, I always tell them that I want the University of Texas to be one of the absolutely top schools of public health in the nation, but I do not mean that on the basis of intermediary endpoints. In other words, I'm not judging that. I'm not going to judge that on the basis of the number of NIH dollars that we have or the number of students we have or blah-de-blah-de-blah. What I really want is to be convinced that we have made public health smarter, that we have basically moved the needle, and that future public health practitioners will be more knowledgeable and smarter and more efficient and effective in what they do as a result of our work.
I have one last question.
Good evening, Dr. Ness. By the way, I am a microbiologist, so I'm very thrilled to hear what you said. And I just want people to know that I didn't pay you to say that. I'm an educator for the past 30 years, and as you know that the quality of undergraduate education is declining in the country. And what are your thoughts? Because partly, if not largely, this drive towards the research, big universities are hiring professors, they are only focused on research and they really do not care about the classroom teaching. And there are a lot of articles on that that prove that.
Yeah.
So what are your thoughts on that?
Well, I think that I can tell you what my hope is. There is, as you perfectly well know, a disruptive innovation that is now with us, and it's really going to be with us, and that is MOOCs, right? So does everybody know what a MOOC is? Massively online open courses. So this is like Coursera, edX, Udacity. These are online classes. They're free. Any of you can take one anytime. I just took one. They're actually quite good, many of them. They're content based. So so every week there are videos that you watch, and there's discussion boards that you go to, and there are quizzes that you take, and blah blah blah. I think that if you combine MOOCs with, which is really high value course content, with the notion of what's been called flipping the classroom, right? Which is what I now do in all of my classes. And the idea of flipping the classroom is that people learn the information outside of the classroom. The point of the class is not to teach information. It is not to teach content. I think that the idea of having people memorize lots and lots of information, which is what I did in medical school, is just stupid. I just want to be clear about that, all right? Because content is so readily available today. I mean, why would you do that? What you need to do is you need to teach people what I call context, not content. So flipping the classroom is about getting people who already have incorporated the content into the classroom to understand what do they not understand, and to elaborate and to discuss and to utilize the information to create a context around that information so that you understand how to think. So the reason why I teach a course in innovative thinking is because I strongly believe that the most important tools that we have to teach students, particularly in graduate education, to some degree in undergraduate education, is how to think. And my greatest concern, how to writing is part of thinking, so communication is part of thinking. But my greatest concern today is that I have graduate students who, when they get to me, they don't know how to think. They really don't, very fundamentally. And so that's what I feel like my job is to do. I don't have enough time, me and of one, I don't have enough time. But I think there's a way forward. I think that MOOCs are a tremendous tool for moving forward, but I think we're going to have to think about education again very disruptively, very, very differently than the way that we think about it today.